Hi, my name is McBride, and I'm a registered clinical counselor. In my practice, I see a lot of people who are struggling with anxiety and anxiety-related concerns. I see a lot of people who have a history of trauma and feel stuck in that trauma and stuck in the distress that trauma can cause. I see some people that are dealing with depression, dealing with addiction or kind of compulsive habits that they don't quite understand, and they want to get a little bit more insight into what is leading their behavior, what's causing this behavior that they don't even want in their life. What led me to focus on these areas is just a general interest in these concerns. I have personal lived experience with anxiety, and so that kind of contributes to my overall understanding and my ability to navigate with people through those challenges. When it comes to trauma and depression, I find that these things can be very impactful, and as with all mental health concerns, I find that with trauma and depression, in a lot of cases, people feel very stuck with these things, and to be able to provide support walking through that and walking hopefully away from it at some point is really motivating and fulfilling for me. My therapeutic approach, I use primarily internal family systems therapy, which is a parts work model that operates with a basic understanding that we all have parts of self, and those parts of self have different goals, different motivations, different fears. When we have an experience of internal conflict, it's often that these parts of ourselves are at odds and there's something that isn't lining up internally amongst or between these parts. And so familiarizing with those parts of self, getting accustomed to how they operate and getting familiar with that, and then allowing and facilitating some dialogue in between those parts to come to some cooperation, some collaboration can be very, very helpful. I'm very adaptable. I do have a couple of key theories and methods that I like to use, but I'm willing to adjust and I'm willing to kind of work with other modalities as long as that's okay for you. For people that are just coming to counseling and maybe have a little bit of nerves about the experience, I want to ease your mind by saying that counseling will go at your pace. I will never seek to rush you through anything. I will never try to push any sort of method or modality or therapeutic style on you. I want this to be very much a collaborative process. I think of it metaphorically like we're doing a puzzle. Like basically what I hope for is that you come to therapy with pieces of the puzzle. We can lay out the pieces together and we can slowly start to put them together again at your own pace in your own time and really in the way that feels best suited to you. At the very least, I hope that every client takes away just a little bit more insight, just a little bit more understanding of what are the contributing factors to behavior? What are some helpful tools that might help to change or adjust behavior if that's what the client wants? In the best case scenario, I hope that a client leaves with a completely empowered view of their own capabilities and their own worth, essentially.